So if I watch her breathing, I can land my hands as she breathes out. At first, it might be unclear where the sacrum is. It's a very large bone at the base of the spine, and angled on people, the angle will vary in its height, but it's the part of the back that angles up. So the back will swoop down into a valley and then come back up into a hill, and it's on this hill that is the sacrum. That's a very comforting place to put a hot pack or even your hands. When you're using a static compression or many techniques that we talked about, it's good to have your hands as relaxed and soft and fully contouring as possible. So if you're holding a lot of tension in your hands, I'm going to exaggerate the movement, but if your hands are really tight, it's going to feel like there's a lot less touching the person, and it doesn't feel as relaxing or comforting. Can you get me a bag of beans right behind you? Or two of them. Watch out, one of them's open. So the effect is like having sandbags on your hands. I'm going to put one on the wall. Or beans on your hands. So that your hands are heavy and soft and fully resting on the person. You can even, when you're playing, you can play with Play-Doh or sand at the beach. You can play with sand and just play till you get your hands nice and soft. A lot of us will hold tension in our hands without even knowing it. And so much of your technique is actually just bringing that soft, confident touch. During this technique, you can just focus on your own breathing. You could invite the client to take some nice deep breaths, or you could just observe their breathing. This can be your first assessment, where you can actually feel and see where the breath is entering their body, how much the rib cage is moving with their breath, and the speed of their breathing. Sometimes people will have little shallow breaths. Christy's breath has actually shifted quite a bit already. There are muscles that run parallel along spinal muscles. They basically run up and down both sides of the spinous processes bilaterally like racing stripes. So right in the center, and I'm palpating very gently, are the little bumps of her spinous processes, and right next to it, on both sides, parallel to the spine, are erector spinae. So this next technique, we're going to use the palm of our hand right next to the spinous processes to kind of scoop out those erector spinae. And so the rest of your hand can make contact in a soft and confident way, while this part of your hand is pressing the erector spinae.
And that's right on next to the spine.
Exactly. So I'm now going to put my finger is right on the little bumps of the spinous process. Actually, I have a fingertip on each spinous process at the moment. And right next to it is the muscle. You can vary your speed of compression. If you're going to do like a pre-sports event massage, you can go at a pretty quick, vigorous pace. Or if you kind of want to do a part of a session that's a little bit more invigorating, maybe the end of the session they need to get up and go back to work or something. But if you really want to let those muscles relax, a lot of muscles relax better if you hold them really slow and steady till they let go and melt. So when you're first warming up, You can kind of do nice, slow compressions. You'll actually feel the erector spinae under your hands, and you can move them out. I'm grabbing onto them with this part of my hand, and I'm pulling them away as I'm pressing them down. And then after I do that a couple times, when I come back, I can actually sink in and slow down to the spots that were extra tight and didn't let go the first couple passes. And if I needed more pressure, I could actually then sink into those tighter spots with my elbows. I'm starting off more gently, warming things up, and then I can slow down and get deeper. So in this area, it's softer and squishier, and then right here, there's a little tight muscle running parallel to the spine that's very tight. It's a little tight, ropey muscle. If you want to get those little tight, ropey muscles to relax, just slow down with them. You want to meet them with counter pressure exactly to the amount of tension that they have. And Christy, on a scale of 1 to 10, if 10 is too deep and 1 is too light and 7 is perfect, where's that pressure at?
5.
Okay.
If you want.
And if you need to get more specific with a spot, you can sink in with your elbow. Now, you are going to need to use your elbow and your forearm a lot. It isn't going to be as sensitive at first in your hands, and so at first it might feel a little awkward, like you're maybe even afraid to use it. But there's going to be a lot of techniques where you're going to just have to kind of keep practicing till it's comfortable. A couple things you can do, since it's less sensitive at first, is to use your other hand to palpate and support and protect. So here I'm finding the spinous processes. You don't want to bump into the bony parts. And then you can put your elbow right next to where you're palpating so that your hand is right around your elbow, palpating what's going on. Some very important things about using your forearm and elbow. You don't want to go in sharp like this, fast or sharp. You want to go in slow and steady with your arm flatter. And then as you're palpating and actually feeling how the muscle's responding and how tight it is, then if you need more pressure, then you can move your hand up, decreasing the angle of your flexion of your elbow, and this will increase the pressure by getting the bonier part of the elbow. But you want to ease into that so that you don't make the muscles jump out of the way or do anything sudden or painful. And Christy, on the 1 to 10 scale, where are we at now?
6. Guessing. You can push harder if you want.
Okay.
Because it feels tight there, so
And how's that?
that's good. Thank you. 7.
This is 7?
Mhm.
Okay. You can let me know anytime with numbers or
Okay.
any words you like if you want it differently. You see I'm moving my hand around a little bit just to change the angle as I feel the spots that are tight. My hand is supporting around my elbow so I can feel what the muscle's doing. If you feel like you'd get a better angle, you could stand on the same side of the spine instead of across the table. You can tell by the softness of the muscle and the client's breathing whether the muscle is actually relaxing because of what you're doing, or staying the same, or getting harder. So if the client is tensing up their muscles or holding their breath, you definitely want to ease up. And on the 1 to 10, if 7's perfect, 10's too deep, where's the sun out?
7.
So it may look like I'm in the same spot, but I'm actually grabbing the tissue, and as it lets go, I'm slowly working my way up the spine through the area of the muscle that was particularly tight. Now, you do not have to go this slowly the entire length of the spine, but when you find a tighter spots after you warm things up, it's good to slow down and actually release the muscles and come out superficially as slowly as you went in. Then you can reassess and warm things up and move them around. If you go this quickly, the movements I'm doing right now, the whole time, you're kind of just flushing the blood in, squishing the muscles around, seeing how tight things are, but not really giving the body the opportunity to change those tensions that much. So it's nice to take the spots that are tighter and slow down a bit. You can get broader areas like that too. Now, if this was too much of a reach, I could do this on the same side of the table instead of reaching across. Particularly if you're taller, you'll probably want to reach across the table. If you're shorter, you might want to try doing this technique from the same side of the table. And a lot of times with your compression, if you add a little bit of rocking, that can help. And as I come up to the top of the traps, you want to be careful that your elbow doesn't slide off. And make sure they're comfortable in the face cradle. As you get closer to the neck, certain angles may be uncomfortable to press into. Same general idea from the other side, but I'm not going to do all the slowing down in the tighter spots. You could reach across, and sometimes it'll actually be more comfortable to approach this from the same side of the table. A lot of massage practitioners emphasize taking the erector spinae and pushing them away from the spine. I actually find it helpful to sometimes even push them towards the spine. Just a little bit of a different angle can help release them. But do notice that if you're standing on the same side of the table or the opposite side of the table, it's easier to push the erectors in medially or laterally, depending on your angle. So incorporating, rocking, jostling works really well as you compress. So notice also that you don't just have to go straight top to bottom, superior to inferior. As you actually palpate what's going on, where things feel tighter and more resistant under your hands, you can actually hang out in those spots more. Is this too much on your low back?
Oh, that's good.
We had a little bit of a low back caution, not a big one. And as I've warmed things up and can feel what's going on, there is a tighter spot right here. So this is an area that I would slow down and do some more specific compression on. Sometimes we had a little bonus crack. I did not try to adjust her back. That is out of the scope of practice. Sometimes the back will adjust itself, but you don't want to try to do it on purpose as a massage therapist. It will often happen though. but that area that was tight was just ready to have the little vertebra go in a happier place. When you're using compression with your forearms, you want to keep your hands as soft and relaxed as possible. If I hold a lot of tension in my hands and I'm stressing out and I'm holding them into a fist, that'll actually decrease the sensitivity of what I can feel with my elbows, and it'll also translate as more force and stress and less responsiveness in my technique. In my technique, I should actually always be able to feel what is actually going on with the client and how she and her tissues are responding. So you can't ever just be doing something to the client. You are always simultaneously feeling. So you're actually feeling and responding at all times. So it's not like, we're not like machines. It's not like learning a technique that you would do on a loom or any kind of a machine where you could just be like, ch, 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 ch. It's like you have this responsive tissue and responsive person that you're actually working with, so you're needing to feel at all times. And a lot of times if you actually don't look at what you're doing, it's helpful. So you can close your eyes, or sometimes if you just space off and look out into space, and that way you can actually focus all your attention onto what you're feeling. A lot of times if you're looking at what you're doing, it actually just gets in the way of what you're feeling. So I am using both hands, and I'm actually rocking and compressing as I'm carving out this space. I'm comfortable doing this with my elbow. If I wasn't, I could use my other hand right next to it so that I could always palpate where the bones are. You don't want to bump into these bones. And then of course here's the spinous processes, and then of course here's the scapula. So you want to be aware to not be bumping into those things.